Now, people will say, does it affect the vaccine? I know you're going to be speaking about the vaccine. We do not think it will escape the vaccine. So just to give you a point of comparison, so measles has the vaccine for measles is about 50 years old. And there are so many variants of measles, but we have never, the measles vaccine variants have never escaped their vaccine in 50 years. Now, in the other side, you have flu, and it takes flu about 5 years to escape its vaccine. And it is much more changeable than coronavirus. So coronavirus is going to be somewhere in the middle. It's either, we're not sure yet, we're still waiting on that. But we do think it will decrease the efficacy of the vaccine. So you know that right now, Pfizer is 95% efficacious. Moderna, I think, is 94, according to the papers that were published in the last few days. What you might expect is with the new variant, it will drop to say 85. It will still be able to protect, but the efficacy will drop.
Why do you say that, Father? What's the basis for seeing that drop and calculating that drop?
What you see the Moderna vaccine is against the key that the virus uses to enter your cells. It's called the spike protein.
The spike protein.
And the B117 has actually changed that spike protein in 8 different ways. Now, it takes many different changes to escape the vaccine, but even just a few changes can decrease the effectiveness of the vaccine. There are experiments that are being done to determine this, but a lot of scientists are expecting this to happen. Now, believe it or not, the Chinese vaccines, because they're not against spike, they're against the whole virus, are less susceptible to this kind of change because because you're not targeting a specific spike. The whole virus is there, and so the immune system is against the whole virus rather than the spike protein.
This is a traditional vaccine.
That's why the traditional vaccine. Yeah, so you will see that the traditional Chinese vaccines are being touted as resistant to variants. And the reason why is because you're not giving the patient a very small part of the virus, you're giving it a large part. So even if the small part changes, there are so many other parts that the body can still attack.
Father, they're resistant to variants, but in the Philippines, I think our problem is resistance to the vaccines itself. OCTA conducted a survey, that's an informal survey, right, on acceptance of vaccines in the Philippines.
Yeah, so
about it.
So OCTA conducted a survey just before Christmas. We hired someone to interview 600 residents of the NCR. And what you're seeing is that you're seeing very vaccine hesitancy across the NCR of varying degrees. Now, I also spoke to my students at UST at the end of the finals period, and you can also see this vaccine hesitancy. And I think, the vaccine hesitancy it's a new drug. It's not quite clear. People are worried it was made too quickly. One of the advantages, I think I pointed this out last time we spoke, one of the advantages that we are going to get because we are not getting vaccines right away is we are going to benefit from the experience of hundreds of millions of vaccinations all over the first world. So we're going to see that. Now, with regards to vaccines, again, my students, it's an informal conversation. What I notice is many of my students are hesitant about the Chinese products. And they're hesitant of the Chinese products because over the last 10 years, there have been stories of substandard medical products out of China. They were telling me about contaminated milk in 2009. And so I think there is even my mother is hesitant about the Chinese vaccines only because she's just very hesitant about the quality of the manufacturing process.
But
so we will see.
What about the OCTA survey? What about the OCTA survey? Did you ask them about brand preference, are they against vaccines per se, or are they against Chinese-made vaccines?
No, in our survey, we just basically look primarily at vaccines for now. We did not really specify individual countries. So I think rather it's interesting rather than brands, because most of the ordinary people are not aware of the brands. If you speak to them about the country of origin, that's really where. And you can see even in, I think in Navotas, there was an informal survey. And
Yes,
again, you
Father.
have residents of Navotas who are very hesitant about Chinese vaccines. So I would not be surprised. The OCTA survey did not directly address that question, but I think from informal conversations I've had and with things that I've read in the news, Filipinos overall are deeply wary of vaccines from China, and we will have a lot of work to do for that.
Okay. But is it also awareness about vaccination in general or just in this specific moment in time about COVID?
Well, I mean, you have after the long-term consequences of the dengue vaccine crisis in 2017. So a lot of people remember that, right? So they remember children getting sick. And so parents are deeply concerned that you're going to get a repeat of that. Now, it's interesting because none of the vaccines so far have actually been approved for children. So any vaccine that we will receive in the next few months is going to be slotted for adults, right? So, but families don't see that, and so parents are worried it's going to affect their children. And I think what government has to do, especially the LGUs, and I know Quezon City, because I'm working with Quezon City, is going to do is we are going to roll out a information campaign to help the residents of Quezon City and therefore throughout the NCR and hopefully throughout the country to better understand these vaccines. I'm working with my students at UST. We're developing infographics in English and Filipino on the different vaccines just to help our kababayans to understand what is going on. Because you are always scared of what you don't know. And so we're trying to help them to understand how many hundreds of thousands of volunteers were tested. If you combine all of the volunteers and all of the trials, hundreds of thousands of people have already been vaccinated. And so we have a good sense of how this vaccine is working.